morning. Glaucoma is a very intriguing disease. There's more than 70 million people worldwide suffering from it, and the most recognized risk factor is an elevated intracranial pressure. Unfortunately, lowering the intracranial pressure does not necessarily cure glaucoma. So if a high temperature is a problem for your health and you're going to a low temperature area, you would expect to feel better. This is not necessarily the case with glaucoma. So the cause of glaucoma is not known, only one of the risk factors is known. But we know that the optic nerve is not a nerve like the other cranial nerves, it is a white matter tract of the brain. So talking about glaucoma is basically talking about a brain disease which is traditionally treated not by neurologists but by ophthalmologists. The standard treatment today is lowering the eye pressure. First you use drops, then you use a laser, and then you do a surgical procedure, a trabeculectomy, by getting a better outflow of water out of the eye. And now we have new devices like MIX, the minimal invasive procedures, which also have the aim to drain the aqueous humor out of the eye and thereby lowering the pressure. If we look at the statistics of the success, we have a high population of people who still progress glaucoma, although their pressure is then in what people consider to be a normal range. So we were looking for additional risk factors. Glaucoma is, as I said, a disease of a white matter tract of the brain. The most common neurodegenerative disease in the brain is Alzheimer's disease. There are in Switzerland, where I live, about 178,000 people currently being treated for Alzheimer's disease, and worldwide it's a disease that is rapidly growing because our population is getting older and older, so it's an old age disease. Now with tissue can regenerate and can usually renew when we're younger. When we're getting older, we get debris that's not moved out of the tissue. And the cause for Alzheimer's disease is thought to be an accumulation of two proteins, a beta protein and tau protein, which accumulates in the nerve fibers and the axons. Now, recent research has shown that a beta protein and also the tau protein may also be involved in glaucomatous disease. Unlike other cranial nerves, the optic nerve is surrounded by cerebrospinal fluid, just like the brain. It is like in a swimming pool. But this swimming pool needs to be cleaned from once in a while, because otherwise toxic components start to accumulate. It usually takes 4 to 5 cleaning cycles a day to keep the environment of the brain and the optic nerve in good shape. Now we found that the exchange of the fluid surrounding the optic nerve in glaucoma patients is heavily reduced. Means that the clearing takes probably place only once a day or even less, thus leading to an accumulation of toxic substances. Recently a new, or not a new, but a not yet well-defined population of cells were discovered that cover the brain, cover the optic nerve. It's like a wallpaper. These cells react to the environment and they have a barrier function. As a barrier between tissue and between fluid. If these meningeal cells, that's how they're called, if they function well, they act like an active filter, taking substances out of CSF that may be damaging for the neurons, for the health of the nerve cells and of their axons. We are at the moment looking at the function of the meningeal cells and try to enhance their clearing function in order to stabilize the microenvironment surrounding the optic nerve and the brain. Thus, a therapy for glaucoma may just as well be an approach that could help to stop the progression of a disease like Alzheimer's disease. So doing research on glaucoma is actually neuroscience, because as I mentioned before, the optic nerve is a part of the brain that connects the eye to the decoder, the central nervous system.